Luther Gulick, Administrative Theory, Application to Hospital and Healthcare Management. Look at this picture. Luther Gulick, Healthcare Management and Principles Post Corb. Look at this. A detail going on. Luther Gulick, an influential scholar in public administration and management, expanded on classical administrative theory through his famous post-core framework. He argued that the work of an executive can be broken down into 7 key functions. Post-core. P means planning, setting objectives and deciding the actions required to achieve them. Example: forecasting, designing program, setting policies. O. Organizing, creating the structure of roles and responsibilities within an organization. Examples: departmentalization, establishing authority, coordination mechanisms. Yes, staffing, managing personal functions. Example: recruitment, training, placement, performance evaluation. D. Directing, providing leadership and guidance to employees. Example: motivation, communication, issuing orders. C. Coordinating, ensuring all organizational units work harmoniously. Example: interdepartmental communication, aligning efforts, avoiding duplication. Or reporting, keeping stockholders informed about performance. Example: records, reports, inspections. B. Budgeting, managing financial resources. Example: accounting, physical planning, auditing. Key ideas in Gulick theory: 1. Emphasizes division of work and specialization in administrative tasks. 2. Focuses on efficiency and scientific management principles. 3. Sees administration as a logical sequence of functions that any executive performs. 4. Contributed sustainability to the development of public and healthcare hospital administration as a profession. Application of Luther Gulick's administrative theory in hospitals and healthcare setting. 1. Planning, designing patients' care programs. Hospitals use structured planning to develop clinical pathways, emergency response plans, infection control policies, and long-term expansion strategies. Example: adding new ICUs or specialty wards, to organizing, structuring departments and roles. Healthcare administration creates clear organizational divisions such as cardiology, oncology, radiology, nursing units, pharmacy, and administrative services, defining authority and reporting lines to reduce confusion. Three, staffing, managing workforce requirements. Hospitals supply staffing principle to recruit, train, schedule, and evaluate doctors, nurses, technicians, and support staff to maintain optimal patient to staff ratios. 4. Directing, leading clinical and administrative terms. Hospital leadership provides daily instructions, motivates teams, ensures adherence to clinical protocols, and resolves issues among staff for smooth patient care. 5. Coordinating, integrating multidisciplinary care. Effective coordination is essential between departments, for example, surgeon, anesthetist, nursing coordination in operating theaters or radiology emergency, collaboration for trauma cases. 6. Reporting, ensuring clinical transparency and documentation. Hospitals implement systematic reporting such as medical records, electronic health information system, quality audits, adverse event reporting, and performance dashboards. 7. Budgeting, managing healthcare finance. Gulick's budgeting principles guide hospitals in allocating funds for equipment, salaries, drugs, infrastructure, insurance claims, and financial audits to ensure sustainability. 8. Improving patient flow and efficiency by applying post-core. Hospitals optimize patient registration, triage, bed allocation, discharge planning, and follow-up workflow to minimize delays and overcrowding. 9. Strengthening quality and safety systems. Using Gulick's principles, administrators develop standardized procedures for infection control, medication management, patient safety protocols, and accreditation compliance. 10. Crisis and emergency management during pandemics. disasters or mass casualty events. Gulick's administrative approach helps hospitals plan resources, coordinate interdepartmental teams, communication effectively, and manage emergency budgets. Thank you. Have a nice day.